Good afternoon, everybody, and thank you for joining us this afternoon. Before we get started, I want to share a few brief housekeeping announcements. First, we would like to thank everybody who submitted questions in advance of today's town hall, and we hope to address many of your questions on the COVID-19 vaccine today over the next hour with our panelists. And as a reminder, if you have additional questions and you're logged in through Zoom, you can please use the Q&A function. And also, just a reminder as well, this is a public forum, so anything that you type will be visible to others. So today's town hall is being recorded and streamed live on Facebook, and you can please feel free to share that link with others so they can tune in, and we will paste that link into the Facebook Live shortly in the chat. And finally, a recording of today's event will be available on the Montgomery County YouTube page, and we'll also send a link out to everybody who registered once the video is uploaded. And now I'm pleased to turn it over to Whitney, our moderator, to start our town hall.
Hello, everyone. I'm so glad everyone was able to join us today to talk about the COVID vaccine and how it affects area seniors. My name is Whitney Lingle. I use she, her pronouns, and I'm the executive director of Montco SAC. We are two senior centers, one in Norristown and one in Ambler, and the largest Meals on Wheels program in the county. So now I'll introduce our speakers and they can give you a little background about themselves. Dr. Arkush, would you like to go first?
Sure. Thanks, Whitney. Good afternoon, everyone. I'm Dr. Val Arkush. I am the chair of the Montgomery County Board of Commissioners, and I'm excited to be here today to answer all of your questions.
Dr. Lorraine?
Thank you, Whitney, and good afternoon, everyone. It is indeed a pleasure to be here, and we're very glad that we have the opportunity to share all this information with you. I'm the medical director of the Montgomery County Office of Public Health, and I've held that position for about the last 4 years. I'm a practicing internist in Montgomery County. I've done that for 35 years. And in addition, I also hold a commission in the Pennsylvania Air National Guard and command a medical detachment.
And Doreen.
Good afternoon. Thank you for joining us today. We're so excited to be here to answer your questions. I'm the administrator of the Montgomery County Office of Senior Services. I've been with the office with the county for about 35 years in many roles, and I'm enjoying my role as administrator, and I hope we get a lot out of today's town hall.
Awesome. So starting off with our first question, it's for Dr. Arkush or Dr. Lorraine. What can you say to people who are concerned Pennsylvania and Montgomery County are lagging in the vaccine rollout? Many people have said it's been difficult to find appointments.
Well, I'll start with that one. So as is no mystery to anybody who is listening to this, we've had a lot of demand here in the Southeast, very high demand among the people who live in our region for the vaccine and relatively low supply. But I am happy to tell you that that is now rapidly fixing itself. And starting this week, the county health department is receiving considerably more doses than we had been receiving. And we're ramping up by the end of this week to start to get that vaccine out and into people's arms. And we're also seeing bigger doses coming to some of our community partners, like pharmacies and other locations like that. So I know it's been really difficult, but that is about to get a whole lot better, I'm very happy to say.
That's fantastic. Dr. Arkush and Dr. Lorraine, can you speak to recent announcements at the federal and state level to open vaccine access? Will we start to see more availability here in Montco, since it sounds like the supply is going up?
There we go. Yeah, I'm sorry, I lost my picture there for a minute. So I think Dr. Arkush kind of addressed part of that question already. We're very, very pleased to note that there is a considerably increased amount of vaccine that is on its way. Actually, some of it has arrived here in Montgomery County. So we're expecting a considerable uptick in the amount of immunizations that we're going to be able to do, and in conjunction with our other partners in the area as well. So it's been a tough haul. We've had the desire, we've had the ability, we've had the infrastructure, we haven't had the vaccine. Now we're getting the vaccine. You can also see that actually, even though it's been difficult, Montgomery County residents have been very ingenious and have been very persistent in scheduling appointments in various places. And a very high percentage of them have actually achieved immunization, which is somewhat gratifying. We wish that we could have helped even more, but now we're poised to really be able to deliver. So we're very, very happy to be able to say that today.
That's fantastic. Dr. Arkush, please share more about the vaccine rollout and where we are with the phases. When do you anticipate scheduling appointments for people who are in 1B?
So we're getting very close. By the end of this week, we will have offered appointments to everybody that's currently on our 1A list. And that includes individuals and businesses that signed up as a business that may have multiple employees that qualify as some type of healthcare worker. So under our current plan, everyone by this weekend, let's say, should have received the opportunity to make an appointment in one of our clinics in the next month, over the month of April. Now, at the same time, many people I'm sure have heard that the state has opened up to 1B as of yesterday. And 1B includes a number of different professions. Around here, our police and firefighters have already been vaccinated, but 1B also includes grocery store workers and some other really critical frontline workers that we are so grateful have been keeping our world going during this past year. So those individuals will also be able to sign up for a vaccine, and we will start also probably by early next week releasing some appointments to them as well. So we'll be sort of incorporating some of them into the finish up of the 1A. So it's good news. I do just want to stress one point, because I know everyone is so excited to get this vaccine that when they hear they're eligible, they believe that there's a vaccine dose with their name on it. But unfortunately, eligibility and availability of the vaccine don't always match up. And that's been our problem here in the county. We've had huge amounts of people eligible, but not enough vaccine available. And so it's still going to take a little bit more time for us to catch up with that. But it's going to happen much, much more quickly than we were forecasting even just a couple weeks ago. So just hang in there. It is definitely coming.
Awesome. The next question is for Doreen. We know we've moved to phase 1B, but what about people, especially seniors who qualify for phase 1A? Are they getting moved to the front of the line if they were to register today, for example?
I believe Commissioner Arkush sort of just answered that with regards to, we're going to continue rolling out the appointments to those that are in 1A. And so I am sure that the seniors will be prioritized, or those that are in 1A will stay in the order of 1A until we're finished with phase 1A. If I'm accurate with that or not?
All right. And this one's for all panelists. How is the county handling immunization of people who live far away from vaccine sites or are homebound?
Well, I'll go ahead and jump in on that one. So there are actually a number of initiatives that the county has undertaken. First of all, we are participating and cooperating with a lot of partners in the community. There are several pharmacies and there are faith-based organizations that have offered either their facilities or their staff and personnel, and in some cases that their vaccine allotment to help us do some outreach to specific populations. So we've been able to get out in several different areas in several different communities that would have a little bit of difficulty in getting to our larger vaccination sites in Willow Grove, Norristown, and Montgomery County Community College. In addition, our Department of Public Safety has been doing a fantastic job with a mobile outreach program that has been going around to various locations, whether they might be clusters of senior citizens or specific shelters, other places that might be difficult to get to. We're actually looking at ramping up that effort now that we're getting the Johnson & Johnson vaccine, which is a single dose vaccine, makes it a whole lot easier to be able to get into those particular areas where there are those people who have difficulty accessing the large sites again. And that this time they only have to get the one dose. There is no booster that's required. We're looking continually to expand this partnership as well. And I would be remiss also if I didn't mention some of our hospital systems in the county that have been excellent partners with us and have gone into retirement communities and assisted living facilities. They've done a fantastic job in assisting to try to get this vaccine to as many people as possible, especially those who might have difficulty accessing it.
We received a follow-up question in the Q&A section. Do we know the number of vaccines that Montgomery County will receive in April? I know from what I've read in the past and from talking to both county health department staff and all of you who've been working so hard to vaccinate us, that was coming out on a weekly basis before. Do we know in advance how many?
Yeah, we do. We have some certainty about it. We will be receiving, in general, about 16,000 doses a week going forward, and that's a mixture of Johnson & Johnson and Pfizer. This week, we're going to receive, on top of that 16,000, another 10,500.
Okay.
So this particular week, we're going to have a little over 26,000 doses arrive, assuming that they all get here. So with that volume of vaccine and that certainty over these next several weeks, it's allowing us to actually schedule many, many more appointments. And I think Doreen might want to share some additional information for folks that maybe need a ride to get to one of our vaccine sites, and then also how someone could register if they or a loved one is homebound. And we'll be putting a program in place for that. So Doreen, I'll let you go with that.
I was going to ask to jump in about that. So
That's perfect. That was on my list. So take it away, Doreen.
So if transportation is an issue across the county, some people just don't want to go that far in a car or can't drive that far. We partnered with, oops, my picture went away. So we partnered with, well, we have Transnet is the county transportation service that a lot of seniors are already aware of. And they are actually, their shared ride program will actually, oh, perfect. Thank you, Kelly. They will actually, if you're not registered already, you can register with Transnet. They are also waiving the day's notice for vaccine appointments. So if you happen to need one immediately, but they will actually take you to the appointments and back, and you are not going to be charged at this time for your normal fare. If you don't know of Transnet already, there's the phone number, and you can call and get registered so that you're ready for that ride when you do need it. We also connected with GoGo Grandparent, which is an Uber and Lyft type service, but it is geared towards seniors. It's for seniors who do not have smartphones to access. They really accommodate, and the feedback I've gotten from those rides has been from the seniors, because I was curious how that worked out, and they said it works really well. They are, very senior friendly, and they can take their wheelchairs, their walkers, whatever they need, and they'll help them with that. So very accommodating. And of course there's SEPTA and CCT, and you can call our partnership TMA at that phone number, and they will help you connect the best route. If that's what you need to take to get to the appointment, they will help you plan that whole trip out. So that's very encouraging. The other thing I wanted to follow up with was the homebound mention too. For those, we are taking, senior services is working with volunteers that actually can pre-register those without internet access or technology and have issues. And that same system is now, we are also taking registrations for people who are homebound, or if you know of someone who's homebound, you would call our county call center at 833-875-3967. And if you mention that you are homebound, that you were unable due to medical conditions leave the home, they will connect you with our volunteers, and our volunteers will pre-register you just like they pre-register everybody else. That way we can track and keep an account of names and geographically where where you're located. And when we continue the mobile and homebound vaccines, we will have that information available. So in answer to that last question, those are some information on those.
That's very helpful. And one of the questions that I saw come across the Q&A was about the outreach. I know area senior centers because we have been doing phone calls with the people that we serve, and I've seen the county do a lot of promotion. Is there any other outreach that's happening to make sure that people who maybe don't have internet access are aware that they can get assistance?
Well, as much as our social media and the county and advertising can pass the word, I know we send information to our legislative offices, and as much as we can spread the word that way. Yeah, so I hope people are, because even if again, even if it could be for someone whose family lives here and the son or daughter lives away and they just don't have a chance to register them, just call the 833 number that I just gave, 875-3967. Our volunteers are eager and willing, and they want to continue to do what they're doing. So
that's great.
And let me just address one thing that came up in that same question. They specifically referenced my chart. And I do just want to be clear, because I know this has been incredibly confusing. The county had nothing to do with my chart. That's actually one of our major hospital systems here in the county that was sending invitations out to individuals that were already patients in their system. And that was just a decision that hospital system made. So the county has not been doing that. The county has had this phone number available now for weeks. We've done everything we can to try to get it out there to people, but we know that sometimes these things do get missed. And then of course we've had our online registration. So I know it's been difficult. The Pennsylvania Department of Health decided from the gate that they would not create a centralized registration system. And so I know that has led to a lot of frustration, but hopefully we're going to have enough vaccine now that those problems are not going to be an issue any longer.
Thank you. I have another question for Dr. Arkush. The number of hospitalizations and deaths due to COVID-19 are creeping back up across the county. Is this a cause for concern?
Yeah, they're definitely on the upswing in a pretty robust way. And we've also seen that we now have 80 cases that have been diagnosed as having one of the variants. By and large, almost entirely that British variant, which is known to be 1.5 times more contagious than the original variant of the virus. So people do need to remain vigilant and careful. We still must continue to wear our masks when we're around people that are not from our household, whether you're vaccinated or not. And still watch your social distancing, keep those hands clean. The reason is, and Dr. Lorraine pointed out, we've been very successful in getting every shot we have into an arm here in Montgomery County. So we have a good number of people that have been vaccinated, but not nearly enough to reach that herd immunity where there's so many people that are vaccinated that your chances of catching the vaccine from somebody or the virus from someone go way, way down. So for now, we definitely need to continue with masks, social distancing, hand washing, avoiding small private gatherings where people might take off their masks.
Absolutely. Dr. Lorraine, with increased availability of the vaccine, will people be able to choose which vaccine they receive? You're muted.
Okay, that should be better. We've been getting that question certainly from the beginning when there were very, very scarce amounts of vaccine. At that point, the answer to the question was very straightforward. The best vaccine to get is the vaccine that you can get. I will still somewhat hold to that. There are minor differences between the vaccines in terms of efficacy and side effects, but very, very minor differences. The Johnson & Johnson vaccine, if you look at a side-by-side comparison, the numbers may look a little bit lower, but you have to take that with a grain of salt. So the studies that were done looking at the Johnson & Johnson vaccine were somewhat later than the other two, where there was a higher background of cases of COVID going on. So the efficacy rates are actually very, very similar to each other. The main advantage, which I did allude to before, of the Johnson & Johnson vaccine is that it is a single dose. The other ones do require boosters in 3 to 4 weeks. And I will just mention at this point that we do have data that says that even those booster doses can be delayed a few weeks if they have to be, up until a total of 6 weeks, and you still have the same efficacy. Now, to get to the meat of the question, can people choose which vaccine? The answer is, since we put in a new system last week, yes. Once they do get their invitation to schedule an appointment, they will go into the system, which will list all of our vaccine clinics at all of our sites with the 2 different vaccines that we will have. We will have the Pfizer, we will have the Johnson & Johnson vaccine. At the moment, we're not getting the Moderna vaccine because that's in short supply, and we can get more if we ask for the Pfizer and the Johnson & Johnson. People will be able to choose which site they want to go to, which day they want to go to that site, and they will know which vaccine is being offered at which site. So yes, they will be able to choose. I will just reiterate, though, that every one of these vaccines has incredible efficacy. We're so pleased with the efficacy rate that was achieved with all of these. The side effects tend to be fairly similar. There's not a whole lot of difference between them. So I would encourage everyone to get the vaccine, to get the one that's most convenient for them. If a choice is available and they have a preference, certainly try to arrange that.
Excellent. The next question is for all panelists. Are there plans to have more vaccination sites and support for underserved communities, especially language support, whether it's Spanish or other languages on site?
I'll start with that. Yes. Now that we have a lot more vaccine coming into the county, I'm very happy to tell you that we are proceeding with more sites. And as Dr. Lorraine mentioned earlier, we continue to partner with pharmacies and other community groups to make sure that we get vaccine to clinics that are specifically set up for people that might speak a particular language or be from a certain ethnic background. And we've been very successful with that. Those are generally smaller clinics, in the 300 to 500 range, but we've been very successful with that. We can make sure that there are people there that speak the appropriate language. So I can give you a quick update on what the county's doing. So as you heard earlier, we have 3 very high volume sites, one right at the Willow Grove Mall or right next to it, one at Montgomery County Community College and one at Norristown High School. We are opening up this Friday in Pottstown at a church that actually is a church, a synagogue, and serves a number of Latinx individuals in the Pottstown community as well. So we will have bilingual people there on certain days of the week to assist that community. So we're really happy to be able to get that site open. We'll also be opening this Friday in Lansdale at the Trinity Lutheran Church. And so that will be another location where people will be able to make appointments. We are close to finalizing, but not quite there yet, a site in the municipality of Norristown. So a little more walkable than the high school is. And then we're continuing to do these sort of smaller, mobile, kind of one-off sorts of clinics as we hear from the community that there's a need. We're working with the Pennsylvania Department of Health to get a better download of data of who has been vaccinated in Montgomery County. We're trying to get that by zip code. And if we can get that data, which we haven't quite been able to get it yet the way we need it, we will create maps of vaccination, and then we'll be able to see visually where are the areas in the county where we're coming up short. And then we can direct some efforts into those locations. So we try to be as data driven as we can be in this effort, and hopefully we'll be able to get that data pretty soon.
Awesome. Will updates on that data be available online so that the public can access it as well?
Yeah, we tend to post all of those types of things at our montcopa.org/COVID-19 site. That's our main data hub site. And there's all kinds of maps and links to guidance and just tons of information on that page.
Very cool. Okay. Dr. Arkush, the variants have been in the news a lot lately and are driving new cases. Do you anticipate vaccinated people will need to get a booster shot to combat these variants?
Yeah, that's a really good question that I don't believe we have an answer to yet. And I'll toss it over to Dr. Lorraine in a second to see if he has any additional information. But So far, it seems that the two vaccines that we're using here in the county, the Pfizer and the J&J, and previously we had the Moderna, are pretty effective against the variant that we're seeing most commonly here in Montgomery County, which is that British variant. But over time, that certainly could change. I just do want to reiterate how important it is, even if you are vaccinated, to keep those masks on, because the more we reduce the spread of the virus, that also reduces the chances of these viruses mutating. And so the quicker we can get this thing shut down, the safer we'll all be. But I'll turn it over to Dr. Lorraine to see if he has any more booster information.
Yeah, so there are two important things that I'd like to add to that. The first one is kind of a philosophical point about vaccinations, and particularly the COVID vaccine. So kind of taking a step back from where we are right now, what is the reason why we are immunizing against COVID-19? There's actually kind of two parts to it. Number one, of course, we would like to prevent the illness, and that's an important statistic that we get. But as important, or perhaps even more important, is we want to prevent hospitalization, severe illness, and death from COVID-19. So when you see the effectiveness reported of these vaccines, you'll generally see two numbers. The first number is what is the effectiveness in preventing the illness itself. The second number is the effectiveness in preventing severe illness, hospitalization, and death. So these vaccines have been incredibly effective. Our target when we were developing these vaccines was to achieve somewhere around 60% efficacy, which is where our seasonal flu vaccine generally is. And instead, we're seeing, in the case of the Pfizer and the Moderna vaccines, we're seeing 90-95% efficacy, which is amazing. And in the Pfizer and the Johnson & Johnson vaccine, we're seeing roughly 70+%. So this is, remember, the efficacy in preventing the illness. The efficacy in preventing severe illness and death approaches 100%. It is amazing. It is absolutely astounding that we're doing that. And what we've seen thus far as the variants go, and this is the second point that I was going to get to, is that this prevention of severe illness, hospitalization, and death is continuing, even with these new variants. We're seeing just about the same degree of effectiveness in preventing that severe illness. It's possible that there may be a slightly lower efficacy in preventing the disease itself, but if you start at 90% and you decrease somewhat, you are still getting an incredibly good effect. Now, along those lines, the question comes up, is there going to have to be a booster, either relating to these variants or perhaps seasonally or yearly? And the answer to that, as so many things are right now, is we will see in time. That's the only thing that's really going to tell us. So we'll have to see as things go along, whether the immunity wanes. There's different parts to it in the body. I won't really get into the different parts of the immunity right now, but there's sort of like two different systems, the direct one and the indirect one. The direct one may go away. The indirect one tends to persist. So we may still have pretty significant protection, either from a variant or a year from now when we expect seasonal changes to happen again. So only time will tell, but we have such a great start with these that we're expecting pretty significant efficacy going forward.
Excellent. Another question that came up in the Q&A that's kind of for all panelists, obviously no one anticipated a pandemic of this scale would occur. So preparations were varied. Now that this has happened and we're living in this soon to be post-COVID world, what mitigations is the county putting in place to prepare in the future for other pandemics, other emergencies of this scale?
Well, let me start with that from the big picture. So first of all, we talk a lot about our crumbling infrastructure in this country. And I think when people say that, typically they think of roads and bridges, or maybe the fact that not everybody has access to good internet. But another area that has been deeply, deeply underfunded for decades is our public health infrastructure. I think as antibiotics became more widespread and vaccines became more widespread, people just kind of forgot about how important public health is. And so unfortunately, we really saw the consequences of that this year. So one of the things we all need to do is advocate for more and much more robust funding of our public health infrastructure at all levels, federal, state, and county. And then second, we follow a procedure in Montgomery County of doing what's called an after action review every time we have a major event of this sort. So we actually did an after action review of the first few months of this pandemic when we went from the yellow to the green phase back on June 26th. Everybody had a bit of a chance to catch their breath over the summer when our cases were a lot lower. And we did a review of how things went in the spring. And then as things started to, unfortunately, ramp back up this fall, we did use that information to guide some of our response this fall. So that's what you want to do. You want to be a continually learning environment. Always look at what you did and figure out how you could do it better. And we intend to do that again once things calm down again soon, which I very much hope is soon.
Absolutely. Do any of you have any, further comments or advice on, as we prepare for, the numbers to eventually go down? You have all already stressed, the need to continue social distancing, wearing masks, and practicing good hygiene. What's your advice for people who are navigating this new future?
I guess the one thing that I always try to focus in on, even before this happened, is the concept of hand hygiene. So, the masks, of course, are right out in front of us. Our social distancing is an issue in terms of going out. And sometimes the hand hygiene tends to get put on the back burner a little bit. I'd like to emphasize that that is probably the most effective way of decreasing not only transmission of COVID illness, but every infectious illness. I predicted at the beginning of last fall that we would see almost no flu this year because of the the different things that we've been doing in terms of trying to prevent COVID. And flu is less transmissible than COVID is. That turned out indeed to be true. We saw almost no flu this past season. Why was that? Well, it's because of all these measures that we're taking. We're wearing masks, we're social distancing, hand hygiene. Wash your hands, keep them away from your face. Remember that going forward. And not only will we prevent, hopefully, this type of pandemic, but all the other illnesses that go around, typically the increase in the fall and the winter, the colds and the sinus infections and all those other things. We can make ourselves a whole lot healthier by one simple intervention like that.
Thank you. Well, I think that's all. Well, one more question just popped up as I started to wrap up. Is there a timeline for vaccines being available by primary physicians?
Well, I'll definitely take that one. So a lot of primary care offices had applied to be vaccine providers. My office, of course, because I'm so involved with this, we were one of the first ones that were approved as vaccine providers. And we did get initially some shipments of vaccine. There was a decision made at the state level to hold back on shipments to medical practices in favor of high volume immunizers because the focus was on getting as many vaccines out as possible to as large a number of people as possible. I have my own personal issues with that, but this is not the forum for it, and I will have to change hats to appropriately talk about that. Some offices have been continuing to do a little bit of vaccination. I am hopeful that as the vaccine supply now is increasing significantly, the state decides that now is the time to bring back the primary care offices who are more than willing to do these immunizations, have the infrastructure to do it, have the locations to do it, have the willing patient population to come in there. I think it's a great partner for the state to be able to get this out to the general population. I'm very, very hopeful that the increased vaccine availability will start this up again.
Okay, well, thank you so much to all of our panelists. I appreciate you taking the time to answer questions. I know at our site, we've definitely been fielding a lot of questions, and you all have been great supporting us and providing the information so we can pass that along. Thank you so much.
Thank you very much. Pleasure being with you today.
Yep, thanks everybody, and thank you for your patience. We know this hasn't been easy, and keep wearing those masks. The end is in sight, and if you haven't gotten vaccinated yet, I hope you heard some things today that will encourage you to think about getting vaccinated. And most importantly, please make sure you talk to your own healthcare provider, whoever you trust the most to get your healthcare advice from, because there's a lot of crazy stuff out there on the internet. Don't pay any attention to that. Almost all of it's wrong. I mean, it's all, the crazy stuff's all wrong. This is nothing short of a miracle that in a year, we have 3 highly effective and extremely safe vaccines to combat this pandemic. And the key to getting back to a normal way of doing things is to get a very large number of people in our communities vaccinated. So we hope that you will take advantage of that, and we are here to help do that in any way that works for you. Thank you.
Thanks so much, everyone.